Welcome, I'm Dr. Joseph Finney. I'm Pediatric Emergency Medicine and EMS physician at St. Louis Children's Hospital. This is Steve Laffey's of Pediatric Emergency Medicine and Director of the STARS program, Medical Director of the STARS program at Cardinal Glennon Children's Hospital. And we want to talk briefly to our first responders, primarily our police officers, about the use of naloxone in pediatric patients who are altered or unresponsive. And I hope this is a situation that our police officers never find themselves in, but it probably will be. This came up, Steve, because I have, I originally was we're sending out a letter to all of our EMS agencies. Who always responds to a pediatric cardiac arrest or a pediatric code or unresponsive patient first? It's always a police officer. In fact, they're the ones bringing the patient out to you a lot of times. So you're first onto that chaotic scene, and we want to give you guys some simple tips to guide you in the management of those patients and potentially save one of those patients. And the biggest thing we want to talk about is when you've got that patient who's unresponsive, altered, something's off about that child. They're just not acting right. They're too sleepy, too drowsy. I want you to think about using naloxone in that patient. And I know you guys carry it and you're thinking to yourself, well, we only carry adult dosing, but Steve, you want to comment on the safety?
It's particularly most of what you carry is intranasal. The absorption of that is widely variable. We really don't know exactly how much is getting into the body. So I would have no hesitation to use a big slug of Narcan in a smaller pediatric patient who's not acting right. In fact, I'd almost recommend it because of the uneven absorption of it intranasally.
Yep.
You're way better off erring on the high side than trying to titrate it up and realize because their nose is full of boogers or whatever, they're really not getting very much of it.
You've underdosed it or something like that.
Yeah, exactly. So don't hesitate to give a lot. If mom says, I don't know what's wrong, but he's just not acting right, think Narcan right off the bat.
That's absolutely right. So I just want you guys to, the next time you encounter a pediatric patient who just doesn't look right, something's off as far as their mental status being subdued, I want you to feel comfortable saying, I'm going to give a dose of naloxone and see if it works, right? It's a little bit of a different world than in the adult community where, you see these patients who are habituated to it all the time. In pediatrics, it's extremely uncommon outside of patients with chronic, medical conditions like cancer or something like that, or in the situation of a baby who's born to a mother who is using some sort of illicit substance. If you're there at the delivery, then I want you to not give that patient naloxone because it could cause withdrawal symptoms in those two situations. Outside of that, it's extremely safe with little to no side effects. So as a first responder, when you get on scene of that pediatric patient who's very somnolent, subdued, something's not right, please administer naloxone, try that to see if it helps. If it doesn't, we're moving on to the typical things we would do anyway, and EMS is hopefully already on their way, but it could potentially reinstate the respiratory drive for that patient and prevent subsequent cardiac arrest and something like that.
The other thing that I think people underestimate is how young these kids, these babies get it. The youngest one we've had at Glennon was 10 days old, probably put in the baby bottle.
Yep.
But 6 months is not unusual. We've had several. So that's another thing you want to, well, this kid's way too young. How could this have happened? I don't know how it happens, but I do know it happens fairly frequently. So don't talk yourself out of it because of their age either, because we definitely see it.
A couple grains of salt, fentanyl is enough. That amount, what I've read is that basically to cover Lincoln's head on a penny is all it takes to completely knock out the respiratory drive of a little child. So, it can be on the ground, it could be on clothes, it could be on the bed, anything. So you're absolutely right, Steve, that's a great point. It doesn't take much and it can happen in very, very young children who aren't mobile, who aren't doing all sorts of things.
Exactly.
But definitely feel free to reach out to either of our institutions. We're happy to help you guys navigate this situation. But again, we just want to encourage you to use naloxone in those situations of sort of undifferentiated altered mental status in a pediatric patient.